Welcome everybody. This case is an 11 years old child who was single-eyed after doing cataract surgery bilateral, and this was a sound eye, and the patient was aphakic with a dropped CTR. So starting to remove the remnants of bag, doing an anterior vitrectomy, going down, starting to do a curved vitrectomy, and freeing the CTR from any vitreous attachment before starting to remove the CTR. Then catching the CTR with a forceps, going upwards and reaching the anterior segment, opening a corneal wound with a keratome, and going with a McPherson to catch the CTR with the left hand, and then going with the other hand, catching the CTR and removing it, making a rotation like it was inserted before, removing the CTR, and then planning to implant a retrobarbillary iris screw, starting to increvate the first haptic and then increvation of the second haptic, and doing a PI, and then going to suture this corneal wound with an 8-figure suture. After cutting the suture and burning it, then going down to make a vitreous base shaving. It was surprising that I found a 3-piece IOL which was dropped, which not proved clinically or in B-scan or even intraoperatively. It was incravated inside the cellular body, freeing this 3-piece IOL and starting to catch the first haptic of this 3-piece IOL. At this moment, I was thinking about how to remove this 3-piece IOL from the implanted and iris screw lens in a pupil not dilatable. Is it better to remove the iris screw lens and removing the 3-piece and reimplantation of this retrobarbillary iris screw? I was fearing from traumatizing the iris and losing the chance to implant a retrobarbillary iris screw. So I decided to insinuate this 3-piece IOL and remove it in between the iris screw lens and the iris, going gently, not to damage the iris and not to lose the attachment between this iris screw lens and the iris. I removed this 3-piece IOL from this wound and it was successful. And then going to suture the wound, going down and making a vitreous base shaving to search if anything more is present inside the eye and to look if there is any degenerations or breaks. Again, I found a lattice present in the lower retina and I decided to make a laser around it because the child, as mentioned, was single-eyed patient, surrounding the lattice with 2 rows. So finally, the home message is recheck and recheck, and don't finalize until you watch the last scene. And thank you for watching.